Welcome to Burris Logistics 2022 Open Enrollment Presentation. My name is Rob Fulton from Rue Insurance, and I'll be walking you through today's presentation. Burris Logistics Open Enrollment period will begin Monday, November 1st and run through Monday, November 15th. Some topics for today's meeting. We're going to follow suit, almost identical to what we did last year in 2021. Our topics for today's meeting will include an introduction, what's new, what's changing, what's staying the same. We'll go through a high-level benefit review, and finally we'll finish with helpful hints as well as the enrollment process this year. As far as a 2021 year in review, I was hoping that 2021 would bring a lot more normalcy back. It seems like we're going down that path, but we're not quite there yet. Hopefully 2022 brings us to the normal that we've all become accustomed to over the years. One of the great things with this open enrollment is that we are not making a lot of changes, so this should be a fairly seamless process for everyone. When we're talking about what's new, I think we do have some exciting changes here. Now, last year, if you do recall, we had enhanced Mutual of Omaha's employee assistance program, and we had increased the face-to-face visit up to 5. What we're doing this year is we are introducing a new employee assistance program offered through LifeWorks by Mornia Chappelle. This will replace that Mutual of Omaha EAP. This is a standalone offering, and it is a great step up. As far as LifeWorks is concerned, they've been delivering EAP services for over 50 years. LifeWorks currently administers the EAP benefit for over 15,000 organizations and 37 million employees worldwide. LifeWorks is the only accredited global EAP certified by the Council of Accreditation, which is the only EAP industry-specific accreditation available anywhere in the world. Again, this is going to be a comprehensive standalone offering instead of simply a rider, which that Mutual of Omaha policy had been. What comes with LifeWorks? You will be able to have 24/7 access. That's going to include immediate telephone support from specialized professionals in counseling, social work, psychology, or human services. Again, 5 face-to-face counseling sessions, but the great thing about LifeWorks is these counseling sessions are going to be per incident. Not per family member, not per household, it will be per incident. Referrals to LifeWorks network of more than 63,000 master's level counselors and affiliates around the world. You will have access to virtual counseling as well. Video counseling for those who may not have the time for traditional face-to-face counseling or may not want to have a face-to-face meeting. Tremendous employee support. There will be emotional support for anxiety, depression, stress management, bereavement, personal relationship issues, addictive behaviors, anger management, as well as sleep hygiene. As far as additional work-life services, you would be receiving practical everyday support that is going to include elder care and child care matching, legal services, financial and debt support, education, relocation, parenting, midlife and retirement, career, and everyday issues. So as you can see, much more comprehensive than what had been in force. We'd receive a lot of questions about this as well. LifeWorks will also include managerial support. So for all you managers out there, hopefully this is a great step in the right direction. It will include support for managing employees, employee referrals, employee performance, referrals, manager personal growth, and workplace safety. And in these times, I think one of the essential aspects of any EAP is critical incident and trauma response. Telephonic and on-site support for critical incidents. This would be, God forbid, there'd be an unexpected death at a location. LifeWorks would be there to assist. Trauma response provides a customized, industry-specific approach with post-incident follow-up. So what else is new? So we actually had something new that took place after last year's open enrollment was rolled out. So I do want to give a couple reminders here, and these are very important. So Burris has amended their Highmark spending account policies. And when I say that, we're talking about the general purpose FSA, the dependent care FSA, and the limited purpose FSA to allow participating team members to carry 100% of their available funds forward from 2021 into 2022. Usually that is not allowed due to the unique COVID-19 pandemic environment that we find ourselves in. The IRS did make such an allowance and did allow employers the option, so Burris did take advantage of that option. Again, this is going to apply to the general purpose FSA, the limited purpose FSA, and the dependent care FSA. So any available unused balances will roll forward into 2022. I will put a reminder out there, though, and this is pretty important, that your policy does have a 90-day run-out period. So these funds will roll forward after that 90-day run-out period is up. So it will be at the end of March, beginning of April, where those 2021 funds will roll into 2022. And it is important to take note of that. You might think, well, why does that run-out period even matter if all my funds are rolling forward anyway? Well, here's why it matters. You can use your 2021 funds to pay for eligible expenses that were incurred during 2021. So if you had a doctor's appointment, let's say in December of 2021, you definitely want to make sure that claim is submitted within 90 days within that run-out period that goes up until the end of March 2022. If you don't, and all that money rolls over into 2022, you can no longer use that money after that run-out period to backtrack and pay for any 2021 expenses that were incurred in 2021. So again, make sure if you have expenses that are outstanding in 2021 that you are submitting those within that run-out period, that first 90 days of 2022. And then again, though, any unused available amounts will roll over after that run-out period comes to a close. All right, so what is changing? What is changing as of January 1st, 2022? So effective January 1st, 2022, those employees participating within Burris Logistics HSA compatible high deductible health plan, again, which is that base plan PPO 2000, those team members are no longer eligible to participate within the general purpose flexible spending account. So in the past, if someone was participating within the HSA, they could not participate within the general purpose FSA. And that is simply an IRS guideline. Just to be clear, at this point, as of January 1st, 2022, any team members who are enrolled in that base medical plan, even if they're not enrolled or electing the HSA, they cannot participate within the general purpose FSA. What they can do, though, still, obviously, they can participate within that HSA, and they can also couple that HSA with a limited purpose FSA if they chose to. The limited purpose FSA has the same maximum allowance as the general purpose FSA. The difference with the limited purpose FSA is that it can only be used for dental or vision expenses. And of course, anyone enrolled in that base plan would still have the opportunity to enroll within the dependent care flexible spending account as well. Another upcoming change for January 1st, 2022 comes from the IRS. So health savings account contribution limits were increased for 2022. They went up slightly. So for self-only coverage, the max contribution in 2021 was $3,600. That goes up to $3,650, a $50 change. For family, it is currently $7,200 in 2021. That goes up to $7,300 in 2022, so a change of $100. HSA catch-up contributions, age 55 or older, remain set at $1,000. No change there. Just a reminder, when we are talking about updated contribution limits for 2022, we are talking about the combination of employer and employee funds. So just be cognizant of what Burris Logistics is contributing towards your HSA, and just realize that you can only contribute then the difference between what they're contributing and this max to stay in compliance. I put this slide in here. There's no change to the actual UNUM benefits. So the UNUM voluntary accident and critical illness benefits remain unchanged. It is the same simplified enrollment process we rolled out in 2021. Same process for 2022, which hopefully is a lot easier for team members. We changed it from having to go through multiple portals to simply calling in. So it's going to be the same exact process. I put it in here because the phone number has changed. That's the one difference. So again, as a reminder, team members' information has been uploaded into UNUM's Burris Logistics dedicated call center. Team members simply need to confirm their identity before receiving pricing, enrolling, or changing coverage. UNUM does not work on commission, so there should be no hard sell. It should be a pretty short 5 or 10 minute call. It should be a relaxed call if you just want some pricing and want to think about it. To enroll or obtain pricing, you could simply call 1-800-824-9334. Again, that's 1-800-824-9334. If you do want to make a change or simply cancel coverage altogether, separate number to call. You're going to call 1-800-635-5597. Again, that's 1-800-635-5597. And this Unum call center is going to be dedicated to Burris Logistic employees. It is going to be open to team members from November 1st of 2021, which is a Monday, through November 15th of 2021, which is also a Monday. They will be open though only Monday through Friday, 8 a.m. to 8 p.m. Eastern Standard Time. What else has changed? So when we're talking about payroll deductions effective January 1st of 2022, those have shifted for the Highmark Blue Cross Blue Shield medical prescription plan. What we have here, and I'm going to let this up here for a couple seconds just so you can study it, but we do have payroll deductions for both weekly as well as bi-weekly employees. You will see it is broken out per plan. We have the PPO 1000, 2000 plan, which is the high plan. We also have the PPO high deductible health plan 2000, 4000, which is the base plan. And then it's broken out by tier: individual, two-person, and family. Again, I'll let that sit there for a minute just so you can take that in. And one reminder at the bottom, due to the No Surprises Act, Highmark will be issuing new ID cards to all participating team members. In the past, you would only get a new ID card if you were making a change, if you were adding a dependent. Now, everyone that's currently active on the plan will be getting a new ID card. It will show your limits on that card. Your member ID numbers will not change. That will remain the same, so there will be no disruption. But just an FYI that new cards will be coming. What is staying the same? So the majority of things will be staying the same. So there'll be no changes to your medical, prescription, spending accounts, dental, vision, disability, and life carriers, and coverages also remain unchanged. Your diabetes, second opinion program, voluntary legal, accident, and critical illness offerings all remain unchanged. And always great to say, your vision and dental payroll deductions remain unchanged as well. Again, when we talk about this benefit review, we're going to go through a high-end overview of each of these lines of coverage. We're going to try to give you some insights into each carrier. There is definitely a great amount of detailed information within Burris Logistics open enrollment portal. So please take the time to go through that portal, take a look at the folders. There's detailed plan designs in there. I know the HR team in Milford spent a lot of time creating that portal. There's also a benefit booklet within that portal, which is about 50 pages. So a lot of great information in there as well for you. So before we jump into the actual carriers and coverages, what I do want to go through is I just want to give you a quick walkthrough of the BeWell platform. So BeWell is going to continue to be in place, and they are coupled with Ribbon to streamline your rewards program. BeWell is a digital experience, gives you simple, secure, and a convenient way to manage you and your loved one's health needs. You can access your health information all in one spot, connect wearable devices, receive personalized health recommendations, and securely share your health data with anyone you choose. Also, obviously, you can receive amazing rewards, which is a great bonus. There are going to be 4 optional quarterly challenges. Successful completion of each component results in a monetary reward for a potential total of up to $175. Another big reminder too is that every year through BeWell, you can qualify for a wellness reward. So stay focused on your health. Register with BeWell and complete your annual physical and lab work, your biometrics, by September 1st of 2022, and you'll earn $50 and avoid a $10 weekly surcharge in 2023. Now we're going to jump into the health insurance coverages and the carriers for you. We'll start off with the Highmark Blue Cross Blue Shield medical and prescription plan. And the one thing I do want to point out is that Burris Logistics will be offering 2 plan options. Both options do offer the identical provider network. So no matter which option you do choose, you will have access to the same doctors, the same hospitals, and the same facilities nationwide. If you do want to search for a doctor, simply go to highmarkbcbs.com and click on Find a Doctor. This is a tremendous network. It is roughly 1.7 million participating providers coast to coast. And just to give you an idea of how big that is, that encompasses 96% of the hospitals nationwide. It encompasses 95% of the physicians nationwide. Pretty remarkable. If we ever do get back to traveling, which hopefully is around the corner, you also have access to a network of participating physicians within 200 additional countries. So we will start off with the high plan here, which is going to be the PPO 1080/60. And what I want to do, I just want to give you a walkthrough of the basics here. And we'll compare this to the base plan PPO 2000. So as we look at this plan, you do not need to select a primary care physician. You do not need a referral. If you go to see your family doctor, you simply have a $25 copay. If you go to see your specialist, you simply have a $60 copay. If you go for routine preventative care, that's going to be an annual physical, annual OBGYN visit. As long as you go to see a participating provider, there's going to be no charge, nothing out of pocket, deductible does not apply. If you are going for a hospitalization, whether it be inpatient overnight or outpatient in and out the same day, you are going to be responsible for 20% of the negotiated rate after you have met your deductible. And on this plan, your deductible is $1,000 per family member up to $2,000 per family. And again, a deductible is going to be something that applies once in a given calendar year, and once that deductible is met, you will not have to pay that again. Unlike a copay, wherever you do see that you have a copay, any service that's rendered, you would have that copay. For example, if you go to see your primary care physician twice, you have a $25 copay twice. As far as lab and radiology are concerned, lab or pathology performed in the doctor's office is no charge. Diagnostic lab work and radiology outside that doctor's office, the member would be responsible for 20%, again, after that deductible. Advanced radiology is going to be your MRIs, CAT scans, PET scans, and MRAs. If performed in an outpatient facility, it's going to be a flat $150. Urgent care facility is going to cost you $25 copay. If you go to the emergency room, you have a $250 copay, which is waived if you're admitted. So I always like to look at this. As far as the emergency room versus the urgent care facility, I know on my plan, it's me, my wife, and my 2 kids. We have taken our kids in for more than our fair share of emergencies. If something is life or limb threatening, if you have chest pains, if you broke an arm, broke a leg, definitely go to the emergency room, no question. If it is something where your doctor's office is closed and your child is running a high fever, certainly I think in my mind, we always try to go to that urgent care facility. One, you see the copay is much less. Usually the wait is much shorter. And if it is not something that is life or limb threatening, I think it makes a lot more sense to check out that urgent care facility instead. Next, we'll look at the out-of-pocket maximum. So the out-of-pocket maximum is going to be your max exposure in a given year. Your deductible counts towards this. Your copays count towards this. Your 20% coinsurance would count towards this. So what this is, for the medical, it's $5,500 per family member, $11,000 per family. Hopefully you don't get close to that point, but if you do get close to that point, as far as money out of pocket, any service rendered past that point in network is going to be 100% covered for you. As far as the prescription drug piece is concerned, your out-of-pocket maximum there is $2,650 per family member, $5,300 per family. Again, if you do reach that threshold, any prescription past that point would also be 100% covered for you. Your prescription drug plan is a 3-tier drug rider. So generic medication for a 30-day supply is going to cost you $15. For a 90-day supply through mail order, you get a discount. You're paying a little bit less than 3 times the copay. You'd be responsible for $37.50. For a preferred brand, a 30-day supply would cost you $45. For that 90-day supply through mail order, again, you get the discount, $112.50. For non-preferred, a 30-day supply is going to cost you $60. And for a 90-day supply here through mail order, it's going to cost you $150. So again, you see the benefit of that discount. This plan also does have out-of-network benefits. So if those 1.7 million participating providers do not cut it for you, if you do need to see someone that's not participating within the network, you have peace of mind that you do have out-of-network benefits. So how the out-of-network benefits work, you have a deductible first. On this plan, that deductible is going to be $2,000 per person, up to $4,000 per family, after which Highmark will cover 60% of what they deem to be usual and customary. So keep in mind, whenever you're going to an out-of-network provider, those providers do not have a contract with, in this case, Highmark. So Highmark is going to pay based on usual and customary costs. So balanced billing can apply out-of-network. That's why you want to be very careful. It's nice to have out-of-network benefits, but if you can avoid that by staying in-network, you're going to save a ton of money. Even the out-of-pocket maximum out-of-network, which is set at $5,000 per person, $10,000 per family, that will only cap usual and customary charges. You would always be responsible for any balance bill difference, so be careful there. The second plan we're going to talk about today is Highmark Blue Cross Blue Shield, what we call the base plan. It's a PPO 2000 8060 high deductible health plan. So before we jump into a walkthrough of those coverages, I did just want to give you a quick high-end overview of what is a high deductible health plan. So a high deductible health plan is a plan with higher annual deductibles than a typical health plan. You will notice that that first plan we looked at, that high plan, had a deductible as well, but that deductible only applied to certain services. For a true high deductible health plan, it's IRS defined, that deductible is going to apply to all covered services, including prescriptions. The only exclusion is going to be preventative care services, which are covered 100% from day one. Everything else will be subject to that deductible before any coverage kicks in. So just be careful you understand exactly how this plan works. This high deductible health plan, which is also HSA compatible, contains also what we call a true aggregate non-indebted deductible. This means that those employees enrolled under Employee Plus One or family coverage tiers must meet the entire family deductible before any benefits are paid. This is a very distinct difference between this plan option and your PPO 1000. So to jump in, let's take a quick walk through this base plan PPO 2000 8060 high deductible health plan. You're going to notice a common theme here. So if you are on this plan as an individual, your deductible is going to be $2,000. If you're on this plan as Employee Plus One or family, your deductible is going to be $4,000. Your co-insurance is going to be 80%. And as far as doctor visits, primary care physician and specialist visits, you're going to be responsible for 20% after that deductible has been met. Routine preventative care, we talked about that being an exclusion. There's going to be no charge from day one, and deductible does not apply to that. Again, that's going to be things like your annual physical, your annual OBGYN visit. Inpatient and outpatient hospitalization, you're going to be responsible for 20% after that deductible. Lab and radiology, you're responsible for 20% after that deductible. Advanced radiology, you're responsible for 20% after that deductible. You see the common theme. Urgent care facility in the emergency room, you're responsible for 20% after that deductible. So your out-of-pocket max on this plan, your deductible counts towards this. Those 20% charges count towards this. That's going to be $7,000 if you have individual coverage, and it's going to be $14,000 if you have Employee Plus One or family coverage. Again, another distinct difference here is that the prescription drug rider is subject to that same deductible. So generic medications for a 30-day supply are going to be a $15 copay, but only after that deductible has been met. A 90-day supply would be $37.50 through the mail order, only after that deductible has been met. Preferred brand, 30-day supply is $45, 90-day supply $112.50 after that deductible has been met. Non-preferred 30-day supply is $60 after that deductible has been met. 90-day supply $150 after that deductible has been met. Hopefully I drove that home. I said after that deductible has been met many times. There's also out-of-network coverage on this plan. The out-of-network coverage, how this works, you have a $4,000 deductible if you have individual coverage. If you're Employee Plus One or family, you have an $8,000 deductible, after which Highmark will cover 60% of what they deem to be usual and customary. Your out-of-pocket max out-of-network here is $6,000 for an individual, $12,000 for Employee Plus One or family. Again, as a reminder, if you're out-of-network, balance billing can apply. The 60% is based on usual and customary rates, and the $6,000 and $12,000 out-of-pocket max only caps those usual and customary charges. You are still responsible for any balance bill difference. Now to jump over, we have the MetLife Dental PPO plan, which utilizes the PPD network. So to walk through this, first thing I'll tell you is that the MetLife network is also nationwide and coast to coast, also a tremendous network to choose from. If you're searching for a participating dentist, you can simply go to metlife.com, click on Find a Dentist, and just keep in mind that your network is PPD when you're looking up a dentist. So this plan does have a deductible. It's going to be $25 per family member, up to $50 per family. Those deductibles will only apply to basic and major services. They do not apply to preventative services. So preventative services will be covered at 100%. You will pay nothing out of pocket, no copay, no deductible. And that's going to be for things like oral exams, cleanings, fluoride treatments, and bite wing x-rays. Again, at this point, we're assuming that you're staying in network and going to a participating provider. For basic services, which are going to include things like fillings, oral surgery, and extractions, it's going to be 80% covered. You're going to be responsible for 20% after you've met that deductible, which again, $25 per person, up to $50 per family. If we go to major services, which are going to be 50% covered, you're going to be responsible for 50% after that deductible has been met. Major services would include things like dentures and fixed bridges. One of the things I do want to point out here with the dental plan is that the dental plan also has an annual maximum benefit. Now, we talked about the medical plan having a maximum out of pocket, and that maximum out of pocket was there to protect you. Once you hit that limit, anything past that would be 100% covered by the carrier. I want to explain to you, and I want this to be clear, that on the dental plan, it's exactly the opposite. The annual maximum benefit is actually there to protect the carrier. So this $1,500 that you see is the most that MetLife is going to pay out. So once MetLife has paid out $1,500 worth of claims, anything past that point, you're going to be 100% responsible for. So please be cognizant of that fact when you are getting a dental service rendered, and be cognizant if you do have a couple major things coming up of when that does refresh for you. This plan also covers orthodontia, so braces, but it does cover only children and children to the age of 19. Now, under the orthodontia benefit, there's going to be a lifetime cap per child, not an annual cap, but a lifetime cap. And that lifetime cap is going to be $1,200 per child. And the orthodontia coverage is at 50%, just to be clear. So I just had 2 kids who just got their braces off. And just to give you a rough estimate, I know in my neck of the woods in Pennsylvania, those braces total cost was about $4,300 per child. So I'm glad that is over with, but this will take care of a big chunk of that, but obviously it will not take care of that entire bill. Hopefully that's a good help for you. There is out-of-network benefits as well. Just keep in mind, when you do utilize an out-of-network provider, a non-participating provider, balance billing can apply, so be careful there. Next, we'll look at the iMed Vision benefit. And the iMed Vision benefit, you do utilize the Insight network. So if you're looking for a participating vision provider, you can simply go to imed.com, click on Find an Eye Doctor. It's going to ask you which network. They have a few, and you're going to choose the Insight network to find an eye doctor that participates within your plan. So whenever we're looking at a vision plan, we're looking at a couple key components here. We're looking at the frequency period. We're looking at the exam. We're looking at the materials. We're looking at the lenses, the frames, and the contacts. So you'll notice here that the frequency period for everything we're going to look at is going to be once every 12 months. So you're eligible for an eye exam once every 12 months after a $10 copay, as long as you go to a participating provider. Retinal imaging can cost you up to $39. You have a material copay here of $25. You'll notice that eyeglass lens allowance, you have 1 pair per calendar year. Single vision lenses will be covered at 100%. Line bifocal, covered 100%. Line trifocal, covered 100%. And lenticular lenses, also covered 100%. With this plan, it is going to be contact lenses or glasses, one or the other in a given period. And I'll jump down to frames. After we talk about the lenses, I like to go right to frames. So your frame allowance is going to be $160 retail. Plus anything over and above that, you would get 20% off the balance. There's going to be no copay for the frame. So depending what rack you go to when you walk into the store, usually the most inexpensive rack is first, and then it goes all the way up. I know everyone in my family has glasses and or contacts. And I know my daughter always walks to the very expensive frames. I know my son sort of stays right near the door, which is always nice. But this is either going to cover the entire cost of those frames or at least a very good portion. When we're talking about contact lenses, standard fit and follow-up is going to be a $40 copay. Elective contact lenses, you have a $135 allowance, no copay there. And then therapeutic or medically necessary contact lenses. That's rare. I've been doing this for 15 years. I've only seen a handful of cases where contact lenses are medically necessary, which means the individual cannot wear glasses. If that is the case, it is going to be covered at 100% with no copay. So if you do go to a participating provider, they're going to take care of that claim for you right at that point of service. If you do go to a provider that's not participating within this network, you will have to fill out a claim form, send that in for processing, and wait for that reimbursement. Next, we'll jump over to Mutual of Omaha. So this will be your employer-sponsored life insurance as well as accidental death and dismemberment. So Burris Logistics does provide full-time eligible employees with life insurance and AD&D coverage at no cost. So non-hourly drivers will receive a $50,000 benefit once eligible. Warehouse team members with fluctuating hourly wage will be eligible for a $35,000 benefit, and all other full-time eligible team members qualify for 1 times annual salary, rounded up to the next $1,000, up to a $100,000 maximum benefit. Mutual of Omaha also takes care of your short and long-term disability, which is also employer-sponsored. So Burris does provide this to full-time employees after 1 year of service, both short and long-term disability, also at no cost. Short-term disability benefits cover 70% of weekly salary, up to a maximum benefit of $1,000 per week for a max duration of 26 weeks. Benefits begin day 1 in the case of an accident and day 8 in the case of disability caused by an illness. Basic long-term disability benefits cover 60% of monthly salary. So you'll notice short-term disability is weekly, long-term disability is monthly. So long-term disability benefits cover 60% of monthly salary after a 6-month elimination period. Long-term disability benefits can actually last until Social Security normal retirement age. So if you do the math, you can see that short-term disability will last all the way up until long-term disability starts if you do qualify for both. Next, we'll jump over to the Highmark spending accounts, the HSA, the general purpose FSA, the dependent care FSA, and the limited purpose FSA. Again, usually these updated FSA limits are announced November in the year prior to the upcoming year. So please keep your eye open for the Burris Logistics on the Burris Logistics Open Enrollment webpage for any important updates concerning those limits. As a reminder, you must re-enroll annually if you do wish to participate within one of these spending accounts. Only those employees enrolled within Highmark's high deductible health plan can participate within the health savings account option. Again, let me repeat that. So only those employees enrolled within the Highmark high deductible health plan, which is the base plan, can participate within the health savings account option. Those employees participating within the HSA compatible high deductible health plan, again, that base plan PPO, high deductible health plan 2000, again, cannot participate within the general purpose FSA effective January 1st of 2022. And again, another reminder, all remaining FSA balances will roll forward into 2022. And just keep in mind what we discussed earlier about that run out period. As far as the spending account limits, here's what we know right now. The general purpose flexible spending account, the maximum limit set for 2021 is $2,750. That's what we have now set for January 1st, 2022. However, that might shift up slightly. Usually it shifts up by about $50. That might go up to $2,800, so keep your eyes open for that. Again, that should be announced around November. Another reminder, 100% carryover is available for these 2021 funds into 2022. HSA participants and PPO high deductible health plan, base plan 2,000, 4,000 enrollees cannot participate within this general purpose FSA. In regards to the dependent count flexible spending account, the year 2021 was very unique in the fact that the IRS allowed us to greatly increase those limits. That was an option for employers, which Burris took advantage of. We do think that in 2022, limits are going to revert back to 2020 limits. So again, keep an eye open for any updates here, but we do think these limits are going to revert back as of January 1st, 2022, and that would be the maximum annual election for unmarried individuals, where married individuals filing separately would be 2,500 and up to 5,000 for married couples filing jointly. Again, 100% carryover of available funds from 2021 into 2022. As far as the limited purpose FSA, those max limits are always going to mirror the general purpose FSA, so keep an eye open for that. Right now, we have this listed as 2,750, but that again could increase slightly. And as a reminder, the limited purpose FSA can only be used for dental and vision expenses. But again, could be something nice to couple with that HSA. The general purpose FSA, dependent care FSA, and limited purpose FSA, again, each have a 90-day run-out period, which happens at the end of 2021, happens again at the end of 2022. Again, just keep in mind what we discussed earlier about when expenses are incurred. Even though you can roll over any unused available funds from 21 into 22, keep in mind that rollover won't occur until after this 90-day run-out period is over. And also keep in mind, if you have expenses that you incurred within the 2021 plan year, you have to submit those expenses within that 90-day run-out period before the end of March. Once that money rolls over into 2022, you can only use that for 2022 expenses that were incurred during 2022. Put a reminder there as well that 90-day run-up period will also be in effect at the end of 2022. And we're not sure what's going to take place as far as a rollover at that point. So please be careful with your elections for this year. Health savings account, again, can only be used by employees enrolled in the Highmark PPO High Deductible Health Plan 2000 base plan. Health savings account is an individually owned account that always rolls over year after year. The maximum 2022 contributions, again, we just talked about that, $3,650 for an individual, $7,300 for the family. You have a $1,000 catch-up, age 55 or older. And again, as a reminder, these maximum limits include your contribution and Burris's contribution. As far as the retirement plan, that's offered through Principal Financial Group. This was just enhanced last year in 2021, so this still holds for the upcoming year, effective January 1st, 2022. So again, you can elect to contribute to the plan, both pre-tax or Roth after tax. Annual estimated contribution limits for 2022 did increase slightly. It had been $19,500 for 2021. It's up to $20,500 for 2022. Age 50 or older, additional catch-up amount remains the same at $6,500. And again, a reminder of the enhancement that was made last year. The company match, dollar for dollar, now up to a maximum of 6%. Small print does not apply to Harrington Union. It's vested upon completion of 2 years of service. Automatic enrollment at a 3% pre-tax contribution. So please make note, you must opt out annually if you're not interested, every year. There's an automatic escalation set at 1% each year, up to 7% pre-tax, and there is an investment options are available. Additional programs available to you at no cost are going to be the Diabetes Wellness Program, Living Connected from CCS Medical in conjunction with your Highmark Blue Cross Blue Shield medical plan offers free diabetes testing supplies to all team members and covered dependents who are enrolled in one of the 2 Highmark Blue Cross Blue Shield health plans and who have been diagnosed with diabetes. So again, while we're going through a high-end overview of a lot of these offerings, a lot of these details and a lot of the contact information is going to be included within your benefit booklet and also within that web portal. So if any of these are of interest, please circle back and dig up those additional details and contact information. MediGuide, America's Second Opinion program, is also offered to you at no cost. Hopefully you never come across a situation where you or a loved one is diagnosed with a serious medical condition, but if you do, this is a great benefit to have. Participating health insurance members are eligible to take advantage of MediGuide America's Second Opinion program at no cost. Team members who have been diagnosed with certain illnesses can have their diagnosis and treatment plans evaluated by disease specialists across the country. MediGuide provides you with access to an independent review from a world-leading medical center. So that is tremendous peace of mind. I know when I had a loved one go through something very serious, the last thing you want to focus on is trying to get that next doctor's appointment, trying to get that second opinion, waiting weeks to see a specialist you want to see, waiting weeks to try to connect with someone that you feel can help you out. So this hopefully gives you peace of mind and lets you concentrate on the important things. I do want to talk to you now about some additional voluntary benefits. Mutual of Omaha does offer you voluntary life. So this would be over and above the employer-sponsored life insurance that Burris Logistics provides you with at no cost. So voluntary term life insurance is available. You can elect an amount for yourself up to 5 times your annual salary to a max of $500,000. You can elect this for your spouse, even if you don't elect the coverage yourself. For your spouse, you can elect an amount up to $250,000 maximum, not to exceed your life election, or 5 times your annual salary if you do not elect this coverage for yourself. For your children, you can elect up to a $5,000 maximum. So what you're going to notice in the benefit booklet, which is also included within the web portal, you're going to see the actual payroll deductions for each level of coverage offered under this voluntary life insurance. And it's going to be broken out in that booklet per weekly and also bi-weekly employees, so you can see exactly where you're at, exactly what amount this would cost you. Keep in mind, too, when you look through that, it's going to give you additional details about the program. And the one thing you do want to focus on is that medical underwriting will be required for any elected amount in excess of the policy guarantee issue threshold. Now, within that booklet, you're also going to see a checklist within the first few pages. And that's going to give you a web link to complete the evidence of insurability in case medical underwriting is required. Through that link, you're just going to answer some simple medical questions. There might be some additional steps involved. Mutual of Omaha will let you know, but you will either then receive an approval or a declination for any amounts over that guarantee issue limit. Mutual of Omaha also offers voluntary long-term disability. This would be a buy-up from the employer-sponsored coverage that Burris Logistics provides you with at no cost. So you can upgrade your coverage from 60% up to 66 2/3% of your monthly salary to the same maximum benefit of $12,500 per month. So the maximum benefit stays the same, $12,500. This would increase from 60 to 66 2/3% of your monthly salary. Evidence of insurability here might be required as well if you do enroll after your initial eligibility period. MetLaw Legal Services is also available to you at a cost. Now, this has not changed. This was known as Hyatt Legal Services, so the name has changed to MetLaw. It is offered through MetLife, but the benefits have not changed. So when life calls for legal services, MetLaw is there for you. Telephone and office consultations are available for an unlimited number of personal legal matters with an attorney of your choice. This could cover matters ranging from money matters to home and real estate, estate planning, family and personal, civil lawsuits, elder care issues, and much more. This costs you $9.70 biweekly or $4.85 each week. It would cover you, your spouse, and any dependents. We did talk briefly about the Unum offerings, which are critical illness and the accident coverage. We talked mostly about the enrollment process, but I did want to remind you of exactly what the benefits entail. So the accident insurance will pay a set benefit amount based on the type of injury you have and the type of treatment you need. So simply put, they do have a fee structure. So if you, because of an accident, if you had a concussion, if you had a coma, if you needed an ambulance, there's a set dollar amount they will pay you. Regardless of how much it costs to fix you up, depending on what happened to you, if it was based on an accident, there's a set amount they will pay you. Those amounts are broken down within the benefit booklet as well. If you do want to see exactly what benefits, what those benefit payouts would entail. It would cover accidents that occur off the job. Any accident that occurs on the job would be covered by workers' comp. It can help you with out-of-pocket costs that medical plans don't cover. For example, the copays and those deductibles that we referenced. The money is sent directly to you. The money would never be sent to the provider, so it is sent to you to help you with those bills or to do whatever you wish with that money. Critical illness insurance pays you directly as well if you're diagnosed with a covered illness, and I listed a couple below for your review. You are paid in one lump sum based on the benefit amount that you elect. So you do get to choose what lump sum amount you want. Obviously, the larger the lump sum you choose, the more expensive the premium will be. The smaller the lump sum, the smaller the premium. You can also use this coverage more than once. Even after you receive a payout for a covered illness, if you're diagnosed with another covered illness, you can get paid out again. Just a reminder, the diagnosis must be at least 90 days apart. And another reminder is that any and all cancer diagnoses do fall under a singular condition. So simply put, if you're diagnosed with lung cancer, and then 6 months, and you're paid out for that, and then 6 months later, you're diagnosed with kidney cancer, it would not be a separate occurrence. They would not pay you out twice for cancer, even though they might be different cancers, just to be clear. So some of the covered conditions do include heart attack, major organ failure, cancer, benign brain tumor, and end-stage kidney failure. And again, you can simply give a dedicated Unum call center a ring, and they can walk you through exactly what that would cost you and get you signed up if you're interested. I wanted to leave you with some helpful hints. And these are things that either they're reminders that we want to make sure that you're aware of throughout the course of the year, or sometimes these are just issues that are brought to our attention more frequently than most, and we just want to put out there in case other people might be having the same issues or concerns. Okay, the first reminders we have for you here. If you are electing Highmark Blue Cross Blue Shield's medical plan coverage for your spouse, please be sure to complete and sign the Burris Spousal Coordination of Benefits Policy Certification and Acknowledgement. This year, it is done through a Google form, so a little bit different this year. If you do need help, please contact your local HR team, and they can certainly assist you with the completion of this document. The second thing is to avoid any claim issues. Please be sure to complete Highmark Blue Cross Blue Shield's Coordination of Benefit Questionnaire. This year, again, everyone who is currently active on one of the Highmark medical plans will be receiving a new ID card in the mail. Each of those new ID cards should come with a COB sticker. You can simply call the number on that sticker to update any coordination of benefit information. If those new ID cards do not come with a COB sticker, you can certainly call member services and have that updated just as easily. I did want to put a reminder out there for you too, not to forget about Amwell. I know over the past year, it has been such a crazy year. Telemedicine, the industry of telemedicine has simply exploded. I know during the peak of the pandemic, we have heard from some team members that Amwell was difficult to reach. There was a longer wait time. I think the volume was simply unexpected. Obviously, the COVID-19 situation overall was unexpected. I can tell you that over the course of this year, Amwell has dumped a tremendous amount of resources into making sure that they are prepared for anything that might come down the road, whether it be a second wave or just an increased influx of calls. So moving forward, I do not expect that you will experience any similar wait times. This should be a simple and easy process. I know this is something that, for me, my wife, my kids, I always have the telemedicine mobile app on my phone. I used it about a month back. It was simple. I actually downloaded the app in about 5 minutes, had a video conference call with a doctor in about 5 minutes, and was prescribed the prescription, which I picked up in about 45 minutes just down the road. So very simple to use. Amwell does offer 24/7 access to a national network of physicians. They can diagnose, treat, and prescribe medication for any common non-emergency medical issue via phone or online video. Obviously, if it is an emergency situation, go to the closest emergency room. If it is a non-emergency, I think this is a great resource. You can create an account with your member ID at amwell.com or via the Amwell app, so it's there when you need it. That's the route I choose to go. Members enrolled in Burris' Highmark PPO and 1000 plan, the High plan, can access this service for a simple $10 copay. For those members enrolled within Burris' Highmark high deductible health plan, this service, like most of the services we talked about, is subject to that deductible first. When we're talking about scheduled hospital visits, and again, when I'm talking about scheduled hospital visits, I'm not talking about emergencies. I'm not talking about life or limb threatening situations. I'm not talking about something that came up unexpectedly. When you know you're going into the hospital, when you are scheduling that hospital visit, please be sure to be smart about it. Even though Highmark Blue Cross Blue Shield's network is tremendously large, you do want to double check. Just because a hospital is participating within your network does not mean that the doctors that work in that hospital also participate. Quite the opposite. Many doctors that work in a hospital do not participate with any insurance. So you really do want to make sure you're doing your due diligence and you are double checking. Make sure that hospital or facility is going to be participating in network. Make sure that any doctor you see is also going to be in network for you. And one of the people that members forget about often is the anesthesiologist. Make sure if you are going in for surgery that anesthesiologist is also participating in network. This is going to help you avoid a lot of headaches down the road. Anesthesiologist bills can be tremendous. So just do yourself a favor and double check that up front. One of the more common questions we have received throughout the course of the year as well has been pertaining to lab work. And I did just want to put a reminder out there. Preventative lab work will be covered 100% by Highmark and has been covered 100% by Highmark, but only if it is sent to Highmark by your provider with at least one preventive billing code per lab work. So to be clear, any blood work ordered for either a pre-existing condition or for the purpose of diagnosing a medical issue, while it will still be covered by your plan, is not covered as preventive. So is therefore not covered 100%. So oftentimes if you go to see your doctor, they might have you go for blood work. So if it is just your standard blood work, if it is preventive blood work, if it is simply for a wellness visit, that blood work should be covered 100%. But if you go for an annual physical, and if your doctor is worried about a condition, if they're worried about an issue you're going through, if they want to check on a pre-existing condition you've been through for a couple of years, even though you're there for a physical, if they refer you for blood work and that blood work does pertain to a pre-existing condition or the possible diagnosis of a new medical condition, that will not be preventative in nature. So while the blood work would still be a covered benefit, it would be covered very differently. It would not be covered 100%. Instead, it would hit that deductible first. So just be cognizant of the fact that only preventative lab work is covered 100%. With that being said, if you do get a bill in the mail and if you're not sure, if it doesn't look right, it never hurts to double check. Go to your local human resource representative or reach out to us directly at Rue Insurance, and we can certainly double check to make sure that claim was processed correctly for you. We could check on the coding, we could check on how it was submitted to Highmark, and we can report back to you, usually within a couple days. I wanted to give you a reminder as well in regards to out-of-network services. So we talked about this briefly when we talked about the high plan and the base plan. Just be careful. If you do visit an out-of-network provider, you always run the risk of being balance billed. So this can get very costly. So just want to tell you to be careful. It's never fun to get a bill you're not expecting after the fact, especially a bill that's much larger than you expect. So one of the benefits of the MetLife Dental Plan is that you can actually request a pre-treatment review. So anytime you're going in for something that you think is going to cost you more than, I'd say, $250, we do recommend that you ask your dentist to send that in to MetLife for a pre-treatment review. All you're basically doing when your dentist comes to you and says, okay, we want to go through X, Y, and Z next time you come in, you're going to write up a treatment plan for you. Instead of having it done first and then waiting for that bill to come to you, you would simply ask your dentist to submit that treatment plan to MetLife. What MetLife would do then, they would look through, they would tell that dentist exactly which of those services they would cover, which of those services they might not cover, and how much they're going to contribute to each of those services. So before you get anything done, you'll know exactly what's covered, what's not covered, and how much is going to come out of your pocket. If you then disagree with it, it's much, much, much easier to come to us at Rue Insurance, go back to MetLife, and to challenge that before it happens versus after it happens. It's much more difficult to overturn the decision after it happens. And that whole pre-treatment review process should only take about a couple days to turn around. Another MetLife dental reminder is that orthodontic coverage is available for children only and only up until the age of 19.
And lastly, just want to walk you through the enrollment process, which again will be for an effective date of January 1st of 2022. So what changes can you make? So you can enroll in any of Burris Logistics coverages for the first time.
terminate or waive coverage without experiencing a qualifying life event. You can add or remove eligible dependents to coverage without needing a qualifying life event. You can enroll or increase voluntary life coverage. You can enroll in any voluntary benefit offering. Don't forget, if you wish to continue within one of the spending accounts, whether it's the general purpose FSA, the dependent care FSA, the limited purpose FSA, or the HSA, you must re-enroll each year. So open enrollment, again, is going to run from Monday, November 1st through Monday, November 15th. ADP Vantage will be pre-populated with your current elections. So here's some actions required by you. We're going to ask that you review, verify your personal information, and that of your dependents, ensuring dates of birth, social security numbers, and your tax status. Make sure they're all correct. Make any desired enrollment changes, save, and submit. All elections and changes can be made from within this portal, with the one exception. That one exception, again, is going to be Unum's voluntary offerings. If you are enrolling for the first time within Unum coverage, simply call Unum's dedicated Burris Logistics call center. Again, they're going to be open Monday through Friday from 8 a.m. to 8 p.m. Eastern Standard Time. That line is going to be open November 1st through November 15th. The number to call if you're enrolling or just want pricing is 1-800-824-9334. If you're calling to change or cancel existing coverage, please call 1-800-635-5597. I do want to thank you for your time today, and I do wish you all have an amazing 2022. Hopefully we all get back to normal. Thanks again. Any questions, please give us a holler.